Carrie, how are you?
I'm good. How are you, Haley?
Welcome back.
Thank you. I had her yesterday, so hopefully just a couple updates will be enough.
Okay. So again, this is Allison White, 25 years old, admitted yesterday for, as you know, pneumonia and sepsis.
Yes.
Neurologically, she remains on propofol at 40 and Precedex at 0.3. Her goal RASS is -3 and her actual RASS is -3. Respiratory-wise, she has the ET tube in, it's 18 at the teeth. She's on CMB vent settings with no changes. Cardiac-wise, her MAP has been above 60 and she's still on NEO at 40. She has a right IJ Swan, it's 54 at the hub, and a right radio A-line. GI-GU, she's got a Foley in place with good urine output. Her skin is intact, we've been turning her every couple hours. She has no nonverbal signs of pain, no grimacing with turns, she looks like she's tolerating it really well. As you met yesterday, Sarah, her sister's at the bedside.
Hi, I'm Carrie.
Hi,
I'm going to be taking care of your sister today.
Nice to meet you. Thank you so much for taking care of her.
Oh, no problem. My pleasure. Allison. Hi there. My name is Carrie. I'm going to be your nurse today, okay? We're just going to check a couple things here at the pump.
Okay, are you ready to verify the drips?
Yes, I am. We say the concentration, it's going at 40 mics per minute. Great. Okay, and the Precedex, 0.3, and then the propofol, it's going at. Okay, and the propofol, it's going at 40. Great. Okay, great. And I know the doctors are going to be rounding in a couple hours, so what we'd really like to do today is to stop her sedation and try to wake her up so that we can do a spontaneous awakening trial. Okay. So let's go ahead and do that now.
Okay.
So we'll turn off these medications. Hi.
Hi.
Oh, I see that you guys made an All About Me board.
Yeah, we did.
Oh, cool. So she likes to go by Allison?
Mm-hmm.
And she has 2 dogs?
Yes.
Oh, what kind?
She has a Lab and a Jack Russell.
Oh,
that she
nice.
loves. She adores them.
Oh,
so
that's great.
I'm sure they're missing her.
Allison. Hey, it's Carrie again. I'm your nurse. Are you having any pain right now? No? Okay, that's great. It's very important for us to assess her pain continually and, make sure that she's not having any pain. That's very important. So it looks like she's pretty awake now. So, Allison, I'm just going to have you do a couple things for me. Can you show me 2 fingers on this hand? Can you show me 2 fingers? Great job. Okay, can you squeeze this hand? It's real tight. Now let go. Great. Now I'm going to be asking her a couple questions to test how clearly she's thinking.
Okay.
Allison, you just stay with me. I'm going to say a series of letters, okay? And every time I say the letter A, I want you to squeeze my hand real tight. Do you understand? Okay. So squeeze my hand every time I say the letter A. S. A. V. E. H. A. A. R. T. Okay, great job. We're all done. And you were to expect that all the other nurses will be, testing her every shift for this, just to test how clearly she's thinking.
Good.
Okay? So for my patient's CAM ICU score, Feature 1, she had a RASS -3 overnight and is now a RASS -1. This is demonstrating a fluctuating course, so she would be positive for Feature 1. She was able to follow simple commands, but on Save a Heart, she had greater than 3 errors and displaying inattention, so for Feature 2, that would also be positive. Feature 3, she fluctuated between a RASS -3 and -1, so that would also be positive. She did not have a RASS of 0. This would be an overall positive CAM ICU score. So she's overall CAM positive. We do not have to do Feature 4 because she was already positive for 1, 2, and 3. All right, right, so it looks like you're awake enough to do a spontaneous awakening trial. We have this new algorithm that we're following. Okay, so basically with a spontaneous awakening trial, we've turned off all of her medications so that she's awake enough to follow commands. It seems like she's able to tolerate the spontaneous awakening trial, so I think the plan now would be to possibly do a spontaneous breathing trial.
Hi, I'm Kim.
Hi,
I'm from
Sarah.
Respiratory. You're
Her
her sister? Hi.
Yes.
Hi, Allison. I'm Kim from Respiratory. We're talking about doing a spontaneous breathing trial with you today, okay? Do you know what a spontaneous breathing trial is?
Not really.
Not really. Okay. Well, I'm here to help out. We're going to assess her and see how she does on the ventilator.
Okay.
We're going to see how her volumes are in her lungs. We're going to see what she's doing on her own and how you follow commands and stuff. I'll ask you some questions, some things to do for me, okay? Okay, and what it does is we take her off the full support of the ventilator and we allow her to breathe on her own.
Okay.
So that's a good thing. That's always a good thing. So we give her minimal support, not a lot, and she does it on her own, and we're always here to assess and make sure she's doing well.
Okay.
So that's it. We give her a little bit and then we kind of watch. Okay, Allison, we'll ask you to do some things and we'll take some little tests and then we'll see how she does and you'll help and we'll just try to get this done.
Great.
Okay?
Sounds good. Thank you.
You understand part of that?
Yes. Thank you for
Okay.
explaining that.
No, not a problem. So you ready for that, Allison? Yeah, you're ready for the tube out. Okay. Great. So that's where I'll get started. So I'll just come around. I'm going to look at the ventilator and things like that and see what numbers they come up with, okay?
Okay.
So we're all on the same page?
Yes.
Great. So let's get started.
Hey, Ardell.
Hi, Carrie. How's it going?
Good. How are you?
Good. Hey, so I heard you're doing the spontaneous awakening trial here.
Yes, we are. She's actually doing great. She's been off of the propofol and Precedex for about 2 hours now. She's currently a RASS -1 and she's doing great. No signs and symptoms of pain, tolerating it well.
That's good. So were you able to follow the protocol and able to do your CAM ICU and neuro assessments?
Yes, we did the CAM ICU and the neuro assessment.
That's great. That's great. I heard you're going to keep her off the sedation to do the spontaneous breathing trial to get her to do mobility.
Yes. For now, we're going to keep the sedation off, do a spontaneous breathing trial, and hope to get her out of bed even with the ET tube in.
All right. Well, you know how to get a hold of me, so if you have any questions, just help me down.
Sounds good.
All right.
Thanks.
Hi.
Hi.
I'm Ann from Physical Therapy. How you doing? Allison, the doctors asked me to come by and see if we could get you up and moving a little bit today. So we want to start that process, get you moving faster, okay? First, what I'd like to do is take these restraints off.
Yeah, now that she's, awake and following commands, she's not at risk for pulling that tube, so we're going to keep them off.
Are you in any pain right now? No. All right, we're going to take this blanket off here.
And Allison wears glasses because she does wear glasses.
Sure.
I think it would help.
Yeah. Oh, here they are. Important for the patients if they wear glasses to have them on when they do things.
So what we're going to do, we're going to loosen these lines here just a little bit. There we go. I'm going to have you bend your knees for me. Can you try and do that? Slide your heel towards your bottom. Yeah. Good. Okay. You're going to reach across with this arm for the edge of the bed over here. And we're going to have you roll onto your right side. What have you do is swing your feet off the edge of the bed here. Okay. And you're going to push up with this hand and this elbow. There you go. Alright, are you dizzy? No? You okay? Alright, just sitting here, what I want you to do, move your feet up and down for me. Kick your leg out straight. Good, lift your knee up. Alright, I think you're ready to try and stand here, okay?
Good job, Allison.
I got my walker here. I'm going to have you put one hand up on the walker, one hand on the bed. Alright, and we're going to try and stand up here. 1, 2, great. Alright, take some deep breaths. Are you dizzy? No? Feeling okay? Okay, just standing here, I want you to shift your weight left and right. Good. Okay, and then just take a couple steps in place. Great. Great job. I think you're ready to go for a walk.